What I wanted to do today, when we get started here, is just spend a couple seconds going through what the North Dakota Human Services does. And, oh, I got the clicker. I apologize. So what do we do? A lot of times people just think Human Services is Medicaid, and it's really a lot more than Medicaid. We do things like support community inclusion. And how do we support community inclusion? We do it through the Developmental Disabilities Division. We do it through vocational rehab and helping people get jobs and stay in their community. We also do it by supporting family stability and things like children and family services, foster care, as well as in-home therapy, as well as providing economic assistance across the spectrum, as well as child support helps create family stability. And then we've already spent a fair amount of time talking about community behavioral health with Rosalie Etherington, and then behavioral health, but there is this other chunk that's out there that's Medicaid. So earlier you heard the governor say that the Department of Human Services, the budget is over $4 billion, and that's right. What I'm gonna talk about as it relates to that, 2.6 billion of that is just Medicaid. What Rosalie was talking about is the community behavioral health system. The community behavioral health system, in essence, is about 350, 400 million, but also 1,750 employees of the traditional 2,200 FTEs in the department. And what we're going to talk about today in terms of social service redesign is approximately another 1,100 FTEs who deliver social services across the state, which is only $173 million for a biennium. So I want to make sure there's an understanding of what we do, but we're talking about where we invest dollars. I think Pam did an excellent presentation. It's quite difficult to follow her, actually, of sharing where we're spending our dollars. So if you think of all the social services that we do, in a biennium, we're only spending $173 million, and a lot of that work is to support community inclusion and support family stability. In some ways, those are our prevention and early, not prevention, but early intervention strategies. So in my introduction, I've been here 2.5 years. Shortly after that first session, we had a retreat, and all the cabinet agencies looked at what their mission statements were. And I looked at the Department of Human Services and said, that is a really boring mission statement. It means nothing. I couldn't understand it. I mean, what does quality mean? What does efficient mean? What does effective mean? So, but actually, if you start to break these things down, they start to make a lot of sense. And if we can become more clear about what quality means, and we can become more clear about what efficient means, it actually carries across the entire agency. So quality means we need to provide services as close to home as possible. And you can define home any way that you would like. You can define it as home community, your home family, your school. We have to figure out how to deliver that service as close to home as possible across all those services. And you also heard, Senator Lee does a nice job. We need to provide it consistently across all areas, but that doesn't mean the same way. One size doesn't fit all. And we gotta keep working together as a state and in our communities to figure out what is the best way to deliver the services using a best practice model, driving to the outcomes that we want. But it doesn't mean we need to do it the same way all the time. Additionally, efficiency. So when the governor gave his open remarks this morning, he said it's taxpayer dollars. We need to stop looking at the primary revenue. The revenue source is our primary driver for decisions. We know there's so many things that we can use taxpayer dollars for to get a better return on investment, to get the outcomes we need, instead of saying, well, this is a federal program that has a higher match. Let's do that program. Now, it may be good, it may save the state of North Dakota money in the short term, but it may not be getting the return that we want as it relates to all the strategies we talked about today. We've said this different ways throughout the day. You know, the other thing I've learned is, you know, messaging is so important, and to think that the media is always going to get the information out that you want out there isn't always true. And so when social service redesign is coming about, we're talking about 1,000 employees, a rewrite of a bill that is quite frankly the largest redesign or rework of social services since the 1930s for the state of North Dakota. All we want to do is talk about structure. Who reports to who, what FTEs go where, who gets what, where does the money go. But really structure just needs to support how we're going to change the process. But the bigger issue is how do we drive the culture change? And the culture change, as some of you may be aware, but we're only one of 9 states that still has a county-administered, state-supervised social service delivery system. What that does is at times can cause great confusion for clients. So we need to be thinking about how all these things work and how we work together as one team. So that's one culture component of this. The other culture component of this is the skydiving. I wasn't able to be here yesterday because my son had an IEP, which was the best IEP ever. Just so you guys know, I mean, IEPs can be really good, and it was the best one I've ever been a part of. And I think she might be on stage after this, but I didn't know that until I got here. But we need to learn how to fail fast. We've been so worried about making mistakes and being perfect that we haven't changed the system at all. And so when this bill was coming together, the legislature really understood that this wasn't about structure. This was about how do we give flexibility to the department and the counties working together with other agencies to make the changes that need to be made as they need to be made. So that is, if there's one key talking point for you to take away from this, it had nothing to do with structure. It had everything to do with the recognition that the legislature made that we need to learn how to do things more quickly and more efficiently than we've done in the past. And so what were some of the ways they got comfortable with that? All of the processes that we're going to do subordinate to the client. So I have to be careful. It's not that we're not going to follow the law, but we're going to develop processes that are in the best interest of the client. We'll make the changes, and then we'll see if it works, and then we'll move that across the rest of the state. One of the other guiding principles is we're going to keep all access points, and if there's an opportunity to create more. Because again, if you go back to the mission of the agency, quality was how do we provide services as close to home as possible. And as it relates to that, you've probably heard this throughout the day, is how do we shift from delivering services in, quite frankly, in a lot of communities, county courthouses, to jails, to schools, to local public health? How do we start to move these things out into the community instead of just being in one place? We can't expect people to always come to us. So with that, one of the big things related to this was the elimination of boundaries. So we still have a state supervised county administered program, but previously if you lived in Stutsman County, you had to receive services in Stutsman County. Now if you're in Stutsman County, you can receive services in Barnes or Kidder or any other county across the state. As part of this, what we did prior to the legislative session is we showed the legislature how we can make changes. So this is my example. Previously, state rule said that we had to complete child protection assessments within 62 days. So think about that for a minute. So a social worker shows up at your house, says we have a suspected abuse, child neglect or abuse. We'll get back to you in 62 days, and we'll let you know what we're going to do. On top of that, we only hit that number 40% of the time. So we said, okay, what are we going to do to make things different? We set a goal of 25 days. And within 3 months, we did 2 pilots, and within those 2 pilots, we were able to do, we were able to hit 50% of child protection assessments done in 25 days in just 3 months. Additionally, we actually found out we had too much staff. So we were able to take staff that were previously doing the assessment work and redirect them to do in-home therapy. Because at the end of the day, the last thing we want to do is remove a child from the home. And what does that do? Not only does that give better outcomes in the communities we're at, but it also creates more employee engagement. So now employees are liking their job a lot more than they used to. They're not pushing paper, they're serving families, and that's what they want to do. So that gets to the greater focus on social work. What I would tell you as it relates to zones is we are creating 19 zones. We are changing the culture. We are giving a lot more flexibility as it relates to moving out across the state. In terms of timeline, there will be new zone directors out in your communities. I would ask all of the schools to reach out to those zone directors and say, here's how we would like to work with you to provide services in our schools. Because the expectation is they are going to start to move out into those schools. So with that is where I'm at. I really appreciate the work that the legislature has done as it relates to this. It has been one of those programs and policies and work that was done that for someone who is new, I know this has been talked about for 20 years. I will give kudos to Representative Porter, who actually was sitting in a chamber meeting and said, you know, we talk about economic development and those type of things. He said this was one of the only bills that they saw that they really didn't have to make changes to. And they appreciated everybody working together. So we know if we can all come together and work together, the legislature will support us. So with that, as the Department of Human Services, the Behavioral Health Division in the counties, we really look forward to working with schools to getting services out into the schools to better serve our children and families. Thank you.